we knew even before they came in to say, we're seeing seizures, that something was wrong. And then they're like, okay, we'd like to do an MRI. So the next day he had an MRI. And when we walked into the room where the monitors were set up with his imaging on 3 monitors, really big, from across the room, I could see that basically most of his right hemisphere was black or a lake. And I just gasped from the door. I wasn't even sitting at the monitor, the computer monitor yet. And so he said, yeah, he had a massive stroke in the right hemisphere.
Hello, my friends. I'm so happy to be with you today. I don't think there can be much scarier than looking at an MRI of your son's brain and realizing that half of it is black. And that is exactly what happened to Audrey as she was navigating the beginning of her son's life, finding out that he was having multiple seizures a day and that he had suffered a stroke while he was in utero. Audrey is the Director of Patient and Family Services for the Pediatric Epilepsy Surgery Alliance. But talking with her, she is so incredibly knowledgeable, you might think that she's a neurologist or an epileptologist. But she is actually a mom. She has gone through this journey herself 21 years ago when her son was born. And now she makes sure that families have access to resources. There are so many good tidbits of information that Audrey and I talk about in this, but there's one that I want you to take away before we jump into the story. And she says that a surgery consult is different than a surgery. So we are specifically talking about epilepsy and infantile spasms in this podcast episode, but there is no harm in going through the motions of meeting with world-renowned teams for whatever diagnosis your child has, because it gets you access to more information and more eyes on your child's case. So I just thought that was an amazing part that she talks with families about. It can be really scary to think that your child might need surgery on their brain, and she helps families navigate that process. I'm going to go ahead and stop talking so we can get right to our story, but thank you so much, Audrey, for being here with us today.
I'm Audrey Vernick. I'm the Director of Patient and Family Advocacy for the Pediatric Epilepsy Surgery Alliance, and that's how we were connected, and I'm thrilled to be here, so thank you for inviting me. But my most important job, of course, is that of a mom. My son, Bennett, is 21 years old, and he had a stroke in utero, a kind of catastrophic epilepsy called infantile spasms, and then ultimately a big brain surgery called hemispherectomy, which I'm sure we'll talk a lot about. He lives in San Francisco with my husband and I. We thankfully have an apartment below our house, so we're able to have him live very close by, almost with us. And then I have a younger son who's 19, who's in college in Oregon, studying computer science. And then we have a very annoying dog named Ruby. And I've been working with the Pediatric Epilepsy Surgery Alliance for about 10 years. And then obviously since my son is 21, I've been navigating that journey for 21 years. So, or just a little bit longer. So that's me in a nutshell.
Well, I'm so grateful to be connected to you and have learned so much from you just about pediatric epilepsy and the options that families have when it comes to surgery and how to be advocates for yourself and what you need. And I feel like anyone who's listening, you don't have to have the exact same diagnosis as Audrey's son of infantile spasms, but she's a wealth of information of navigating the healthcare system as well as learning how to be an advocate, even at the beginning phases. And I think, Audrey, one of the things that struck me is when I sent you the form to fill out to be on the podcast, how much you just took me right back to those first beginning moments, like what you remembered from your 3rd trimester and those first 5 months. Can you take us back to that and share a little bit about the beginning of your journey?
Yeah. So, I wasn't yet a geriatric mom, but I was not a young mom. I was 36 when Bennett was born. So there were the usual worries, during pregnancy. And, it seems like every 5 minutes it was like, is something wrong? Is something wrong? I didn't go into the doctor all the time or anything. I wasn't that far, but you worry about things. But I kept, every time I was checked, everything was fine. And my pregnancy was ultimately very typical. But there was a concern at one point that I might have something called placenta previa, which I think is where the placenta is kind of blocking the birth canal. If I remember correctly, it's been a while, but that ended up not being an issue. So that was the only scare I had during my pregnancy. And I didn't have any other issues that I'm aware of. And then I went into labor late. I actually was scheduled for a cesarean if I didn't give birth by, 42 weeks. So at 41 weeks and 6 days, we did all the things to try to make the baby come out. And I did go into labor, but it took a couple of days for me to go through labor, which is very long. And then I pushed for 4.5 hours, which is also unusual. And of course, at the time, I didn't know. You don't know what you don't know. So later, when I told people about this, they were like, wow, that's a really long labor. Like normally they don't let you push that long. And he was also sunny side up. So he was upside down on the birth canal and had to be manually turned during that 4.5 hours labor. So about halfway through. And then they let me continue to labor for a long time. But ultimately I did have a cesarean because his heart rate was starting to decelerate and they were really concerned about him. So that is how he was actually born. And when he came out, he was blue. He had some meconium in his fluid and he was whisked off right away for doctors to revive him. I remember his first APGAR score was 2. And it's so funny, like I did not know anything about childbirth, but somehow I had this idea about these scores in my head, which maybe parents shouldn't know about. And so I was asking my husband who was with me, what was his APGAR score? What was the APGAR
Yeah.
score? And then
Yeah.
later we found out that his second one was 7. So he never, he did not have good APGAR scores when he was born, which is, it's not a good measure. He also had a very large hematoma or like blood-filled bump on his head because I had pushed for so long that he'd gotten stuck in the birth canal. And I was by then pretty out of it, but my husband said 2 doctors had to pull him out during the cesarean. Later on, once I knew that he'd had a stroke and all of this, a lot of my friends who are moms who have babies who had stroke all had very similar labors and all ended up with cesareans. And so anecdotally, I heard that babies who had a stroke in utero are difficult to birth. But at the time, we had no idea that this was even a possibility, and no one suspected anything when we were in the hospital with him.
I feel so much for you, just how exhausted and tired and going through surgery. And I just want to go and give you a hug for all that you had to endure at just the physical trauma that you endured. A manual
It was
turning.
pretty brutal.
Yeah. Yeah.
Yeah.
And then your son is whisked away to the NICU and you're just kind of coming out of surgery. Do you remember
Mhm.
those early days in the NICU and what that was like for you?
Yeah. So he was whisked away to the NICU briefly, but I want to say it was maybe within a couple hours he was returned to me. I was
Okay.
kept in the hospital for 4 days because I'd had a cesarean and that was the protocol at our center. He did have the Billy ribbon lights for a couple days because he was a bit jaundiced, but we didn't have anything unusual, other than the birth. So the next few days were just recovery. It was Thanksgiving weekend. My mom brought us a turkey in the hospital because she had to bring us a turkey dinner. And, we watched TV. He had a lot of trouble nursing. So I had a lot of visits from the lactation specialist, which I later also found out was related to the stroke. But again, at the time,
Yeah.
we didn't know why he couldn't latch. And so that was very, very difficult. But the immediate post-birth time was not, we weren't worrying about him because we were told everything was fine. So other than a few little blips, we just figure everything's going to be okay. That was hard, but we're going to get through it. And, we didn't really think anything of it. And then we went home 4 days later. And to us, he seemed like a perfect baby. It seemed like everything was just fine.
Yeah. And so what were the next few months like? You mentioned challenging, feeding at first,
Yeah.
a lot of crying,
Mhm.
colic, you said in the
Mhm.
form that you filled out, or maybe some of the words that you heard as you were
Yes.
bringing up
Yes.
concerns.
Yeah. So having a baby is a brand new thing and nobody knows how to do it until they have one. And I still remember and loved so much nursing him. And I'm glad that I was ultimately able to do that. And when you're nursing your baby, you spend a lot of time just staring at them. So I was, like every mom, you look at every movement they make and, they shoot their little arms and legs up and, they do all this cute stuff because they're babies and there's a lot of reactive movement that's a startle, right, to their environment. If there's a loud sound or just because, right? So I noticed that he was doing these things, but I didn't think anything of it. And I think I brought it up at one doctor's visit, early on within the first few weeks. hey, I'm noticing that he does these little shoots an arm out or, does these like jerky movements. And she's like, oh yeah, that's just Moro reflexes. Those are totally normal. Don't worry about it. So again, I was reassured. But I would say within the first 6 to 8 weeks, we started seeing what was described to us as colic. He would get very, very, very fussy. We would see more of these movements. And we had no idea. We had not heard the word seizure epilepsy. We did not suspect anything. And then he would just be inconsolable for sometimes hours after these startle reflexes or what we thought they were. And so he was about 5 months old. It was Mother's Day, and he had this episode where I don't remember the preceding, spasms, but I do remember that he just cried for about 7 hours. We just could not get him to stop crying, and just uncontrollably. There was nothing we could do. We were bouncing him. We were trying to feed him. We were rubbing his feet. We were giving him a hot bath, and we were giving him a cold comfort. We were trying everything, right?
Yeah.
And our pediatrician his doctor had a after hours number where you could leave a message. So we called, it might've been me, it might've been my husband, but I'm sure it was a breathless and panicked and annoyed phone call. I'm like, what the heck is going on? This is not good. And later that same night at about 9 p.m., we got a call from her office manager saying the doctor would like you to come in tomorrow afternoon at the end of her clinic day at 3 o'clock. And we were like, okay, again, still like, maybe this is normal. And we got there and she said, I'd like to refer you to a neurologist. I don't really remember the rest of the conversation. I just know it was the first time I heard the neurologist. And I think I even said something like, what's a neurologist or what's a neurologist for? And she said, this might be epilepsy. So that was the first time I'd heard that. And then, so I went home, it was still not yet 5 o'clock, I think. And I started calling every neurologist in the Bay Area, San Francisco Bay Area where we live. And I kept getting, yeah, we can get your son in 3 months or 6 months or whatnot. And I'm like, but I have a baby who's maybe having seizures right now. I can't wait. And so later that night, a friend of a friend, you know how it is. You call everybody you know.
Yes.
Called us back and said, my sister's cousin saw this neurologist who was great. Here's his phone number. And by now it was late. It was maybe 8 or 9 o'clock at night. And so I'd call and leave a message at this office and describe what I was seeing. 45 minutes later, the nurse at this, Dr. Bello is the neurologist his nurse called me and said, Dr. Bello will meet you tomorrow morning at the hospital and he's admitting you for 48-hour video EEG monitoring, which is standard protocol now that I know for infantile spasms, which is considered a medical emergency. And you can't wait. You can't wait 2 months. You can't even wait 2 days to treat infantile spasms. And so that was just a miracle. And so then the next day we went into the hospital. They hooked him up to an EEG. He was having something called hypsarrhythmia, which is a very distinctive pattern on EEG, where it basically looks like anyone looking at it would say, yeah, that's probably epilepsy because it's so spiky and kind of jumpy. So their spikes go up and then they go over and then they go down and there's a lot of them. And so we knew even before they came in to say we're seeing seizures that something was wrong. And then they're like, okay, we'd like to do an MRI. So the next day he had an MRI. And when we walked into the room where the monitors were set up with his imaging on 3 monitors, really big, from across the room, I could see that basically most of his right hemisphere was black or a lake. And I just gasped from the door. I wasn't even sitting at the monitor, the computer monitor yet. And so he said, yeah, he'd had a massive stroke in the right hemisphere. So that was the beginning of this past 21 years, really. I mean, like kind of the true beginning of certainly the medical journey, and snapped me into action to really stop thinking, this will be fine. You really have to trust yourself on this journey. And I think that our culture makes us second guess ourselves so much as parents. There's so many how-tos and, be the best version of yourself. And we're always like, oh my God, am I doing this right? And there's so much parenting information out there that we can't get to that I think sometimes it sets us up to feel like a failure. But there's one thing every parent listening to this which is an expert in their own child. So you might not be an expert in their condition yet. You might not be an expert in every aspect of their life yet, but you are an expert in that child because you're their mother or father and you're with them every day and you know them. So trust yourself and don't let that doubt creep in, and just know that you are the only one probably that knows your child as well as you do. And believe in yourself and use that as a tool to get more information when you need it.
We need that member of your child's care team. It can't just be the providers. It has to be your voice too.
I switched
Yeah.
from being that mom to being the mom that's like, okay, I need to learn everything about this and I'm going to figure this out. And my coping strategy is very much the more I research something, I can fix it. That's my style. And so you can imagine how little sleep I got in the coming weeks and months, spending a lot of time with Dr. Google.
Yeah. Yeah.
So yeah.
Absolutely. I'm kind of thinking about parents who are listening right now, and maybe they're having that gut feeling that you're having, that it's more than the Moro reflex. And as you said, it is a medical emergency. So,
Mhm.
what are the recommendations of the neurologist and parents like you, and
Yeah.
as the director and as the director of this amazing organization? Do you tell parents just head to the ER?
Yes. But the problem with the ER, so let me just back up a step.
Yeah,
The Pediatric Epilepsy Surgery Alliance is part of something called the Infantile Spasms Action Network. It's a conglomerate of many different advocacy organizations, neurologists, epileptologists, community partners that all know that infantile spasms are an emergency. So we have the Infantile Spasms Action Network. There's a website where you can go and look at some example seizures. There's an Infantile
great.
Spasms Action Awareness Week. What happens, what we see, and I see this on the Facebook group sometimes, a parent will say, but even post a video of their baby and say, I think these are seizures. What do you think? And everyone will chime in, yes, that's infantile spasms. They look very distinctive. So they're either a head drop or nod. Like babies don't just drop. It's like almost like the back of their neck was released,
Yeah.
like a doll. You know, those dolls where you can push underneath and then everything collapses. That's not a normal baby movement. So that's one thing. A flexioning, like going forward or contracting out in the abdomen, where they kind of can go in or out. And then what my son had was probably the most subtle, where he literally would just turn his head slightly to the right and lift his arm up, just a little, like you wouldn't know it was a seizure unless you knew exactly what to look for. So what happens is they see something suspicious. They call their pediatrician. Maybe they see their pediatrician and the pediatrician says, they're fine, because maybe they don't demonstrate this during the visit, or maybe the pediatrician isn't trained in what these look like, which is part of the work of the Infantile Spasms Action Network, is to better train clinicians, or they go to the ER. ER doctors are not trained to look for these. And if you don't know how to push and say, I want to have my baby to have an EEG at least overnight, and we want to see the neurologist or epileptologist. So I didn't even know the word neurologist when I started. An epileptologist is a neurologist that specializes in epilepsy. So the people at the hospital in the emergency department are looking for other types of conditions, and they do sometimes diagnose epilepsy in the emergency department, but you really need to make sure that you're asking for and or sometimes demanding to speak to a neurologist or an epileptologist. There will always be someone on call, and that you request that video EEG monitoring so they can actually see. Most infants that are having it, and it does come up most often in infancy, will have some hypsarrhythmia, this distinctive pattern on EEG immediately, or certainly within at least a 2 to 4 hour EEG. However, not having seizures on an EEG doesn't mean you don't have epilepsy. It just means they didn't capture it during whatever window of time. So for parents, what I always say is if you think something's wrong, something is wrong. And you need to, your child, what's been normal for your baby. So if something is changing, having videos is super, super important, because it might not happen exactly the same way when you get to the hospital. You might be too panicked to really describe what's going on. So watching your baby for a few hours or a day, or maybe a couple weeks, even we've seen families because they just don't know, and that's fine. And then bringing those videos in and maybe a log of what you see. Because just showing up and saying, I think this is a seizure, my baby's making weird movements, you're more likely to be dismissed, unfortunately. So those are some of the things that I would suggest. And going to Infantile Spasms Action Network and looking at what these seizures look like, because they look very benign, but they are actually a catastrophic form of epilepsy, and they can cause damage to the brain. They can cause an impact to cognition. Every week the child is seizing, they can lose IQ points, can be recoverable later if the seizures are controlled, but this is not something to be patient about. It's the one time we
Yeah.
really have to be the bull in the china shop. And unfortunately, it's not widely known about even among clinicians, right? Even among pediatricians or ER doctors. So there are some neurologists that are not even familiar with infantile spasms, but less and less. So just being
Yeah.
the mama bear, really, unfortunately, or daddy bear, there's data bears out there that are the primary caregiver, just making sure you're not taking, just don't take no for an answer.
I like that. I want to just consolidate and make sure everybody heard. You can go to the ER and you can request to see a neurologist or an epileptologist,
Epileptologist.
and that those are on call a lot of times. So they may not be in the ER. You may have to wait, but you can request to see them. Second of all, take videos. Visit
Mhm.
the website that you mentioned to see if they are matching what you're seeing. And it's okay if they're different, but take videos and take logs whenever possible. And
Mhm.
also, whenever you can, it has never been easier to take notes on your phones and write down what you're
Right.
seeing and when it happens and what you notice. And even the smallest detail that a parent shares can change providers' perception of what you just said. So I
100%.
always say, write down everything, like even dictate it if you don't
Mhm.
have the bandwidth to write it. Dictate what you're
Mhm.
seeing and get it somewhere so that you can then, like you said, it's so normal to be panicked in an ER. And when you're amongst clinicians and providers who do this every day, but you are the expert on your child.
Mhm. 100%. Yeah. And the other thing too about taking notes is that you might not recognize a pattern, but seizures tend to happen in patterns, right? And especially with infantile spasms, they tend to happen in what are called clusters. So you might say, I saw 20 seizures or of these jerks in 30-minute window. Then there was nothing for 4 hours, and then there was another cluster. But you wouldn't know that language or even to think of it that way until you start logging what you
Yeah.
see. And then you might notice that pattern, or you might go into the ER with your notes and hand your phone to the doctor and say, this is what I've been seeing, 9 a.m., 9:01 a.m., 9:15 a.m., 9:17 a.m., and then again at noon, and then again at 3, these clusters. And a skilled neurologist is going to look at that and be like, without even seeing an EEG, it's warranting an EEG. Now we have some data, that or the video, that combination is really powerful.
Yeah. I feels like fast forwarding and that doesn't feel fair, but just moving in a little bit into your journey in terms of finding out that surgery, in addition to possibly medication, would be helpful for your son. What was that
Mhm.
process like?
Well, so at first we were told he had a stroke in utero and had infantile spasms, which, I didn't know at the time, thankfully, that they were a catastrophic form of epilepsy. I probably would have panicked more. But our neurologist, Dr. Bello, gave him a cerebral palsy diagnosis, which it was another gut punch. Nobody wants another label or another diagnosis for their child. But that opened the door for services for us that we could start getting him into early intervention and therapies and whatnot that we would not have been able to access otherwise. So we're really grateful that we had that. And so he started doing all of these different activities. He had frontline medications for the infantile spasms, which is Sabril and ACTH, or vigabatrin and ACTH, which combined is a first line treatment. And that did control his seizures for a few months. But unfortunately, later that year, about 9, 10 months later, the infantile spasms returned. And then we spent about 2 years playing around with medications and combinations before surgery. So thankfully, Dr. Bello, our first neurologist, had said to us probably a week or two into our initial journey when Bennett was 5 months old, you might want to think about a hemispherectomy. And I just kind of was wide eyed and trying to pull out the Latin roots of that word to understand what that meant. Hemi is half, ectomy is cut. I'm like, what the heck is that? My husband got so angry, he stormed out of the room. He did not want to hear that. But the seed had been planted, and I started thinking about it and researching it and learning about it. So that 2 years later, when we were really out of options medically with medication, we were asking our hospital for a surgical workup, and we were asking for a hemispherectomy in particular. And locally, our team said that they didn't think he was a surgical candidate, but our neurologist, Dr. Bello, who we started with, had moved by then to the Mayo Clinic. He was doing an epileptology fellowship there, a second one. And he said, come here, come to the Mayo Clinic. We have some tools here that they don't have at your local center. And, you should do that. And we're like, okay, great. So we went.
Yeah.
They did 24-hour video EEG monitoring was kind of their first thing that they do. And then there was a bunch of other fancy testing they were supposed to do, but they came in the next day as a team, the epileptologist, the head of neurology, and the surgeon. And they said, we think Bennett is a candidate for a hemispherectomy. Do you know what that is? And by then I did. I'd done a lot of homework. They said, we're seeing all the seizure activity in the right hemisphere. Nothing's transferring over left, all the focal onsets on the right. He has this massive stroke. And I'm like, well, but you wanted us to do all this other testing. And they say, no, we're good. We're recommending, this is our recommendation. And we're like, okay, yeah, let's do it. Can you do it today? And the room got really quiet. And they said, well, usually families like to go home and think about this. And I said, we've been watching our babies seize 300 times a day for the past 2 years. We're not leaving without surgery. And so they scheduled us for Friday. It was Wednesday. And I joked around, you guys have a golf game this afternoon? Like, why not today? Right. So like 2 days later, he had his hemispherectomy. I remember distinctly the morning of his surgery, he had a cluster of seizures when we were getting him prepped for surgery. So we brought him in, they take vitals, right? They make us initial his head, what side they're going to cut. And right before they gave him a dose of Versed to like calm him down so we could get him into the operating room, he had a cluster of seizures. And I was holding him and I was thinking, please God, I hope this stops. I really hope this is the last time we see these. Yeah. And then they sedated him with this Versed just to make him sleepy. I just carried him down this really long hallway. The Mayo Clinic is like a movie version of medical center because there's just a huge long wing of operating rooms. And I don't know, I feel like I walked 3 miles down the hall to the operating room and laid him on the table. And then about 9 days in, the surgery was a success. He had a bit of a rough recovery. I mean, I have to say, disconnecting and removing parts of the brain is not a small procedure. Yeah. So about 8 or 9 days of pain, vomiting, trying to get things under control. But about 2 weeks after surgery, we got on an airplane and flew back home. And on the plane, parents will appreciate this. He was 2. And he only had about 2 word phrases before surgery. His speech, everything was really suppressed by his seizure activity. So he really wasn't making typical progress for his age. But we got on the airplane and he sang the entire Elmo song, not just Elmo's World, but like, he's got the music, he wrote the words, like everything. And it wasn't completely intelligible, but he was saying 40 words in a row. He was singing the whole, my husband and I were sobbing and people were looking at us like, your kid's not that good of a singer. And we just could not believe it. And so from that moment on, it was just the seizures were suppressing him so much. And some of the seizure medications when he was at the hospital at the Mayo Clinic after surgery, they usually resume all seizure meds after surgery because there is a risk of seizure activity postoperatively. And he did have a couple seizures in that immediate postoperative period, which was devastating, right? Worrying, but it's normal. And then, but when we left, they said, we're going to take him off of one of the 2 meds he's on because by then we were down to 2. And they left him on another one for a year. But just having him off that one medication and not having any seizure activity, we just resumed normal therapies. He didn't do any intensive inpatient rehab, which is sometimes needed for older kids who have a hemispherectomy or a child who didn't already have an impairment. Bennett already had a stroke in utero. So we already saw the hemiplegic cerebral palsy. We already saw some impairments, right? So he really went back to his baseline within 2 weeks and was back to being just, his usual funny, challenging, and, just smart and chatty self. Like it was crazy. His language took off, his physical abilities returned to baseline, and then he was able to make more progress. So for us, it was like, how could you possibly take out half your child's brain? And then our only regret afterwards was not doing it sooner.
Yeah. Wow. That Elmo story just speaks so much to me. It's like you get to see your kid be a kid.
Yes. And and then when you see things like that happen, you recognize how much wasn't happening and how much that the seizure activity was really holding him back. And that was a very clear example of that once he was free of those debilitating seizures, he was able to just explode developmentally. So,
I've heard that with transplant families too. When before the transplant, just your child is sick, and then post-transplant, you see what they're actually able to
mhm.
accomplish when their organs are working like they should.
Yeah, yeah,
What I'm hearing is that and for you, this may not be the case, but a lot of stress in making these big decisions. Like, are we going to do this surgery? It's a really
mhm.
big surgery and it feels huge and it is huge. For families who have kids with seizures that are not from infantile spasms, but just have epilepsy, not just have epilepsy, but have epilepsy, are they candidates for this type of surgery, or
Yeah,
what types of things can they do if medications are
yeah,
working?
yeah. So my experience with Bennett led me to the organization I now work for, the Pediatric Epilepsy Surgery Alliance, which is the only caregiver led organization that is dedicated to helping children with drug resistant epilepsy from that point of drug resistance through the surgical decision making process and then beyond school, transition to adulthood, all of it, social emotional support, coping strategies, peer support. We have many, many programs for the families. But that point of drug resistance, once your child has failed two medications that are appropriately dosed, so it doesn't mean they tried a medication and had a rash and had to stop, right? But if they were able to tolerate two medications, they get to a therapeutic dose and they still have epilepsy, they still have uncontrolled seizures, even if they're just the little seizure or there's just a few or it's just when they sleep, that epilepsy is considered drug resistant epilepsy. And it's also very harmful to the development of a child. It also leads to very high risks of SUDEP, the highest risks of SUDEP. It's actually the number one cause of death. Children with drug resistant epilepsy are more likely to die of SUDEP than any other cause. That's sudden unexplained death due to epilepsy. And we don't know what causes it, which is why it's unexplained, but it is part of epilepsy, something that's not talked about enough. So if you have a child that's had seizures of any type and they're not controlled by medication and you have not yet been referred to a neurosurgical evaluation, that's something that we can help you with, or you can start by asking your medical team for that. If you're not already working with an epileptologist, you're just working with a neurologist who's not an epilepsy specialist, I would start there, talking to an epileptologist or an epilepsy specialist. Usually they work hand in hand with an epilepsy surgeon, and they would start what's called the pre-surgical workup. So they're starting to look at your child's case and decide, could this be drug-resistant epilepsy? What type of epilepsy is this? Is it focal in onset or multifocal? Meaning, is there one place in the brain where it's starting, or is it really firing all over the brain? What kind of developmental comorbidities are there? Because of sometimes there's a multifocal epilepsy and the child is severely cognitively impaired. They might be less likely of a candidate for what's called a resective surgery, where they remove the part of the brain that's causing the problem, but they might still be a candidate for something like a VNS device, which is in the neck, or even an RNS or DBS, which is in the brain, neuromodulating the seizures that could reduce the mortality risk for the child, even if they can't stop the epilepsy altogether. So it's really a conversation and a partnership at that point with your medical team, but recognizing that this is a team sport now, right? You can't make these decisions with one doctor. You really have to be getting a set of eyes on this problem because it's very complex. I'll have parents ask me all the time questions like, well, my child has this condition and they have these seizures. So what kind of surgery could they do? And I say, I'm not an epileptologist. I'm not a neurosurgeon. I can give you a list of questions to ask your surgeon. That's something we have on our website, but I can't answer that question for you personally, but we can help guide you to finding a center. If you're having that difficulty getting to a center, we actually have a travel scholarship. So if you can't afford to get to a level 4 epilepsy center for a pre-surgical workup, we can help pay for that. We can connect you with a parent support navigator who's a trained peer who's been through this journey and can talk to you about their own experience when they walked through it, right? I'm a trained peer supporter, and then we have about 30 others around the country and actually around the world. And then, understanding what drug resistance is. That's something else we talk a lot about on our website and in our webinars and whatnot. What does that mean to be drug resistant? There are some leading experts that say if your child has a lesion, meaning like a stroke, a tumor, some sort of underlying condition where there's something visible on MRI, basically, they're called lesional. One medication needs to be failed before you do that referral for a surgical workup. And a referral to surgery is not a surgery. It's a referral to surgery. It's starting the conversation. It's opening up another toolbox of possible solutions for your child. It's informing you of all your decisions so you can make that informed decision. Because what happens is if you allow someone to make the decision for you, you're not able, you really need to be asking enough questions so that you have all the information so that you can make that decision for your child. And one thing I will say about decision making, oftentimes we see different decision making styles between two caregivers. So mom and dad or partners, maybe it's a grandparent and a single mom, all different kinds of scenarios where two people are the primary caregivers for the child. And one person, like for me, when Dr. Ballo said hemispherectomy, I immediately went to, oh, I'm going to look that up tonight. I'm going to find out all about that. I'm going to learn everything I can. And my husband got angry and stormed out of the room. His thought was, there's no way you're touching my child's brain, right? 2 years later, we're begging them to touch our child's brain and take out of his brain to stop the epilepsy, because by then we learned how devastating epilepsy was to him and how much it was holding him back and how risky it was to his development and his mortality and all of that. I didn't really recognize until many years later, my decision-making style is to learn everything there is to learn about something, everything. Talk to everybody I can about it, read about it, learn about it, research, just go on and on and on, and then make a decision. My husband, and this was pretty recently, like a year ago, we had this conversation and we were with some friends, and he said, well, my decision-making style is to have the least information possible that I need to make the decision. And if I had known that early in our marriage, we would have saved a lot of arguments, because recognizing your partner's decision-making style can make a big difference in how you're going to make this decision together. Some centers, some epilepsy centers have decision coaches, or they have counselors that are there to help you talk through making big decisions like this with your partner, with your co-caregiver, right? So that you can be on the same page, so that you both can understand the pros and cons. Sometimes there's different literacy levels for the two caregivers. One parent gets it, reads all the journal articles or reads our website or whatever, watches a webinar and it says, yep, I understand this is good. And the other parent's like, I don't even know what they're talking about. So we have to find ways to help you and your partner, whoever's making the decision with you, to be on the same page, to have the same level of understanding. It's something else we do with the Pediatric Epilepsy Surgery Alliance, because we want you to be able to make an informed decision about your child's care.
I love your point about a surgical workup not being surgery, and that those are two different things. And so that if you're scared or uncertain, I love that the fact that you can go get this information and walk through and hear and ask your questions, and possibly even find more resources through that workup than you would have if you just looked it up on the internet or something like that.
There's a statistic I read a couple years ago, and I need to find the paper because I've referenced it a couple times. I don't have it at my fingertips, but I'll try to find it. It talked about the surgical evaluation and the percentage of families that choose not to do surgery. Of that group, there's a 30% improvement in seizure control. So why would that be, right? What happened? What happened is they took a deeper look. Maybe they learned more about the underlying condition. Maybe they learned about what the focal onset was or what region of the brain was firing and had better understanding. Maybe they did a genetic workup. They did something extra that maybe helped them find a better medication, medication that was better tailored to that child's epilepsy. So you might go through an epilepsy surgery workup and choose not to have surgery and still have an improved outcome, because you just have, like I said, that team approach where you have multiple people looking at it, multiple sets of eyes, and they're looking at it in a much more detailed way, right? You've gone from the Jiffy Lube to the Porsche mechanic team, right? The pit crew for the, Porsche races, whatever. I'm not a car person, but you get the idea.
Yeah, I'll ask my son later.
Yeah, he'll know, right? Okay, good.
It kind of brings me back to, what is your favorite part of being his mom? And what do you love so much about him?
I think that he is remarkable. I know we hear this all the time, and I don't like the term warrior, by the way. I really don't like to think of him as a warrior. He didn't choose this. This isn't a war. This is his life. But he has faced so much in his life. He's been through multiple brain surgeries. He's been through more therapy than I could probably even tell you how many sessions of therapy he's had. He's been poked and prodded. He has multiple impairments as a result of his stroke, visual, motor, auditory, got sensory issues. And every single day he gets up and he walks out the door and he does something with his day. He has some mental health struggles right now. He's 21, but overall, he's got a part-time job. He's going to taking some college classes. He has friends, and he really does have a pretty positive outlook on life overall. And I don't know if I could do what he does. I don't know if I could. I mean, maybe I could, but I just see an incredible amount of tenacity and perseverance with him. And it's not that there aren't times where he thinks, God, I wish I didn't have a disability, or I wish I didn't have to struggle with this. But for the most part, he's just moving forward every day. And I think that's what we all want to be doing with all of our struggles in life, is just working through them and not sitting around saying, well, I can't do anything because I have X, Y, and Z. It's also really motivating for me. I'm like, if my son can walk up that big hill to our house, I'm not going to take the bus because he walked up the hill today. I'm walking up the hill today. Things like that. We had step counting wars where we try to out compete each other in steps. And it's like, I can't let him beat me, but he does sometimes. So that kind of thing. So he is really tenacious. He's really, he's just got an incredible amount of perseverance, and he does have a really good sense of humor, and he's funny. So I think that's something that carries you a long way as well.
It's so beautiful as you're saying these words. And I obviously don't know him, but I've known you and we've gotten to speak together a few times. It's like holding up a mirror. I find you to be so tenacious, so well spoken, so motivated. I feel like he learns a lot of that trait from you. You just being such an amazing example. Oh my goodness. Of course.
Thank you.
It has to be your voice too. Well, we've said probably a billion acronyms today, maybe the most we've ever said, but the Pediatric Epilepsy Surgical Alliance, where can families get connected to this and see all the amazing resources that you've put together?
So our website is epilepsysurgeryalliance.org. Without the pediatric, it's not in our web name, epilepsysurgeryalliance.org. And then we also have a YouTube channel, which is PES Alliance on YouTube. So if you can just search Pediatric Epilepsy Surgery Alliance. We have about maybe almost 200 webinars there now on various topics. And on our website, you can click through all of our resources that we have. And if you're interested, for example, in parent support, there's an intake form for that. And also, if anyone just wants to email me or our organization, my email is the first letter of my first name and my last name, which is avernick@epilepsysurgeryalliance.org, or you can just do info@epilepsysurgeryalliance.org and ask your question, and we're happy to share more information.
Wonderful. Well, thank you so much for all you do and all you give back to families and for sharing your personal story as well. As a parent, you want to be there for your child, especially when it comes to their health. But healthcare can be overwhelming and confusing. The good news is child life specialists are experts who help families navigate these challenges. But often our support is only in hospitals. So imagine if you had access to these valuable tools and resources all the time. You would be able to understand medical procedures, explain them to your child, and help them feel less anxious, which also makes you probably feel less anxious. So when your child visits the doctor, has surgery, or has a medical procedure, having the right information and support can make all the difference. You, the parent, can be prepared to answer their questions, calm their fears, and advocate for their needs. Child Life Specialist tools are ready to be in your hands right now through our app Support Spot. All you have to do is go to the iOS or Android store, type in Support Spot. We are giving all of our listeners on this podcast access to the app for just $19.99 for an entire year. You are going to have, I'm not kidding, 7 years worth of resources and support and information that we have been building at Child Life on Call at your fingertips. With these tools in your pocket, you can transform the way your family experiences medical care. Parents, you deserve to be informed and feel confident in your child's healthcare journey. And by having access to Support Spot, you can ensure that your child feels supported and understood no matter what medical challenges come your way. For those of you who are joining us today, I am not a doctor. I'm not a therapist. I am a child life specialist. And the suggestions and tips and resources that I talk about with parents on this podcast may be great for you and they may not be right for you. So the most important person you can talk to about getting support is your care team, your doctor who knows your story and your child's story. So regardless of maybe what I mention or what other families mention here, we're not licensed therapists, we're not doctors. We're having a conversation about what the parenting journey has been like. So please keep that in mind as you listen today. Hey everyone, it's Katie. We've started running ads through Libsyn to support this show. These are called programmatic ads. We do not pick each brand, but we can block categories that don't align with our values. Your support means the world, and this helps us continue creating great content, pay some bills, and hopefully upgrade our gear in the future. Thanks so much for being such a loyal listener, and I'm so glad you're here.